Honestly, I believe we have one of the greatest transplant programs in the entire nation. And that comes about through a partnership between our wonderful hospital partner, University Health System, that actually oversees the University Health Transplant Institute, the Texas Liver Institute. And so all of us work in unity, in unison, and in vision, to really provide the best care for our patients.
Texas Liver Institute is a freestanding liver program that has both a clinical arm as well as a clinical research arm. And really the mission was to be a one-stop shop for patients with any type of liver disorder. And so this partnership with University Health as well as UT Health San Antonio has allowed us to use different resources, human resources as well as other resources, to deliver what we think is optimal liver care to a very broad population.
I think the approach of treating every candidate for liver transplant as if they were the very sickest on the waiting list is a critical factor in our success. We immediately began to look at the situation knowing that their medical health could deteriorate acutely at any point, just by the nature of their diagnosis and the nature of liver disease in general.
I saw a lot of potential in this institution to expand liver transplantation and honestly to build a living donor program, because I saw that the wait lists were long, the wait list mortalities were high. There are different scales of complexity. Donors' complexity can rule them out for living donation at many centers. Those are not rule outs at our institution. I think one of the most important ones is in the living donor transplant is a liver paired exchange program. Now, in simple words, it means that if there is a donor that's incompatible with their recipient, we can swap them with another donor from a different pair so that both the pairs are now compatible. And that's something that's been known to exist in the kidney transplant world for more than 10 years. But in the living donor liver transplant arena, we were the first center in the US to do that in 2019. And since that time, we've done about 10 liver paired exchanges of different degrees of complexity.
The donor champion program and the concept behind that was we were going to take a person with marketing expertise, really knew how to coach people to tell their story, and teach those people who needed a transplant, or maybe someone they had identified, to tell that story, to get their story out. I don't think we ever envisioned it would increase altruistic donation or directed donations or increase the number of donors self-referring themselves to our program, but we've seen it successful on all of those fronts.
My liver donation journey started when my friend's husband went into acute liver failure and his wife posted on social media that they needed a living liver donor. I had no idea that a living liver donor existed, so I prayed about it, signed up for it, went through all the testing for it, and it turns out that my liver was too small. So I thought that my liver donation journey was over, but I got a call in September and they asked if I would donate to an 8-month-old pediatric recipient. I didn't know.
When she was born at the hospital, she did have newborn jaundice. Her jaundice never really went away. By her 2-month visit, I had noticed she was projectile vomiting and she started to have white stools. Her pediatrician had said that she was okay, but I needed a second opinion. So we went into the ER. When we were told that she had liver failure, I just felt hopeless, really.
Living donor liver transplantation has changed really the world of liver transplants in the sense that individuals can get transplanted sooner before they get too sick. And also for children, we have the opportunity to transplant them at a very, very fast rate. I mean, just imagine being a mother or father of a child in desperate need of a liver transplant and having to wait months. Often, we can transplant that child in a week.
We were told that Ariella didn't have much time left. We knew that it was an altruistic donor and just couldn't believe or fathom that somebody that we didn't know was willing to do this for my child. Since I was not able to donate for her,
Words don't even describe the amount of joy that you get from giving. The gift is priceless, and it's just so cool getting to actually meet her and see what she looks like and be able to be part of the family.
What I love most about working for University Health Transplant Institute is this unrelenting passion for leaving no stone unturned. They're always going to find a way to treat a patient innovatively, find the right and a safe living donation for them. And secondly, is when I was first interviewed to work here, during the course of my interview, what I was told is that we will never be too big to treat every patient that comes to us like they're our family. And I think those two things, leaving no stone unturned, doing it safely, and treating every patient we see like they're our family, permeate this entire institute.